Now to your community focus. We are once again talking with Dr. Jim McDonald from the Rhode Island Department of Health. He joins us live each month right here at 4.
And today he's joining us live via Zoom. Dr. M, thanks for being with us.
Kim and Brian, it's great to be here again. Very happy Thursday to you.
Happy Thursday. Dr. M, the CDC just came out with a study that found roughly 80% of Americans 16 and older have some sort of immunity to COVID-19. That sounds like good news. So what should we take away from that finding?
Yeah, it is good news. And I think it would be better news if it was everybody, quite frankly, and we're not quite there yet. You know, what we're seeing is most of the folks who have immunity got it from the vaccine, and that's still the best way to get immunity. But some people have had natural infection do get immunity. The trouble with natural infection is we don't know if you're going to get immunity from that for a long time. And one of the things you have to remember is SARS-CoV-2 is a coronavirus. You don't normally get long-term immunity for years from coronaviruses. It's a common cold virus. So it's nice to have the short-term immunity. Still need folks who have gotten the disease themselves to actually get the vaccine.
Dr. M, we are in our back-to-school coverage right now. Schools in other parts of the country, though, have been back in the classroom for weeks in some cases. What are you watching from those communities? Any immediate observations or things you're thinking maybe we should make some changes in our plans here on what you're seeing?
Well, I think the Florida experience has been really quite striking. You know, one of the things I think people sometimes forget about Florida is it's really hot during the summer. So they're all inside and they're all air conditioned. But quite frankly, without wearing masks, that's been a real problem. And I think one of the things you see in Florida is they're seeing a lot of cases. And now some of the school districts in Florida are wearing masks, but I think you see where it's a challenge. There's tension over this. That's why I'm really glad in Rhode Island that was settled for us and that we are going to be wearing masks in schools. But what you're seeing is the schools that aren't wearing masks, you're seeing a lot of kids with it. And now one of the things we have to remember is this year is different because Delta COVID is different than wild type COVID. What you see is people have larger viral loads. They're more contagious. So the mask is more important this year than it was last year. So in addition to my crayons, by the way, which I'm ready for school to start, Kim and Brian, I've got my mask handy as well. And I do make mistakes, so I've got my erasers handy as well. Nice colorful collection there because school's going to start soon and I'm excited about it.
And Dr. M, I wanted to talk to you about the booster shot or the third shot of the COVID-19 vaccine. Our Target 12 colleagues found that thousands of people in Rhode Island have already gotten the third dose of either Pfizer or Moderna. It's currently only available to people who are immunocompromised. So I guess I have a two-part question. What's the status on the rest of the population getting boosters? And do we know what the dosage is going to be?
Yeah, so the vaccine booster is the same vaccine you got the first 2 times. It's only the Pfizer and Moderna folks who are getting boosters. So it's great that people are getting their boosters. We're still waiting for guidance from the Advisory Committee on Immunization Practices on when to start the next booster for the general population. For people like me who, you know, it'll be October for me when I get my booster, and I'm looking forward to it as much as anyone look forward to a vaccine. But I think what we're going to find is come September 20th and beyond, you're going to see more and more people getting the boosters. And I think this is one of the things you're seeing is that it's not a shock that we all needed a booster. It's one of those things that we think will help in the long term. But right now, it's just for the folks who don't have the immune system that works as awesome as it should.
And Dr. M, you mentioned that's for Pfizer or Moderna. What about the folks who got J&J?
Yeah, for the folks who got Johnson & Johnson, right now, we don't have a recommendation for you. They've done their own research, but they haven't gone to the Center for Disease Control or Food and Drug Administration with their data yet. I've seen some of it, but wait and see. But they actually did a study that looked about 6 months afterwards and showed they had a really profound rise in antibody. So I wouldn't be shocked if we get that recommendation coming before the end of this year. We'll have to wait and see.
And Dr. McDonald, we have about 45 seconds. Let's talk symptoms. COVID, allergies, flu season is around the corner. Doesn't hurt to revisit the symptoms that should maybe raise a red flag as possible COVID.
Yeah, one of the key things is it's really hard to tell the difference because quite frankly, if you feel like you're having a little bit of fatigue and a runny nose, Delta COVID does that to some people, and it looks like allergies for some people. So although normally allergies are kind of mild, flu feels like you get hit over by a truck, COVID looks like everything. So my advice, if you've got some symptoms that are new, even if you're convinced it's your allergies, go to portal.ri.gov, sign yourself up for a test. Let's get that solved right away.
Dr. Jim McDonald from the Rhode Island Department of Health, thank you so much for being here.
Thank you, Kim. Thank you, Brian.